Now, earlier I talked about the social determinants of health. Your well-being depends on your food, your environment, your job, and your available resources. And since 2014, Metro's focused on population health, trying to fix the root causes of problems that impact the community's health. If you can prevent or minimize health issues, it improves outcomes, efficiencies, and lowers cost, which of course benefits all of us. It's called the Institute of Hope, Health, Opportunities, Partnerships, Empowerment. Metro screened 80,000 patients for the social determinants of health. If they find a barrier, they try to add a fix to the prescription.
So understanding who's impacted across what different domains, whether that's food or housing or transportation, and then to do our best job to strategically design services and supports and interventions to meet those needs.
If it's a problem they can't solve, they partner with those who can.
Really collaborate within the community and the community-based organization that is available. And we build the Unite Us, which is an electronic referral platform.
COVID pushed hospital at home initiatives. That means medical house calls and a better way to evaluate obstacles.
And you will see what is available to them. You will learn if they have a refrigerator that is working.
The data is invaluable and can be used to help other communities. They're already seeing results.
We're also seeing somewhat of a trend towards decreased use of the emergency department.
Regardless which zip code you live in, you should have equal access to the best acute care that you can have.
Now, food insecurity is another health issue Metro is tackling. They've partnered with the Greater Cleveland Food Bank and committed 1 million free meals to the surrounding community over the next 5 years. But they're also teaching patients how good food can be good medicine. According to Feeding America, more than 14% of people living in Cuyahoga County can't afford good quality food. Those who are food insecure have higher rates of chronic disease, such as diabetes and high blood pressure. To combat this, MetroHealth started the Food is Medicine Clinic.
The first thing that I steer them towards is our fresh fruits and vegetables.
Ohio grocery prices increased 12% this year. According to the Greater Cleveland Food Bank, demand for assistance is up 11% from pre-pandemic levels. There is more need now than ever, but often those who need healthier food don't know how to find it.
All the foods that we have are diabetic friendly. We are getting foods that are lower in sugar, lower in sodium, but we're really promoting the fresh foods as well.
Think of it like a pharmacy, only the medicine tastes better. Who visits?
MetroHealth patients who have screened positive for food insecurity, and they have either diabetes or high blood pressure, or they have had a recent hospitalization for congestive heart failure.
Shelves are stocked thanks to the Cleveland Food Bank, and produce is donated or locally sourced. Here, patients get more than groceries.
Each participant is going to receive, each time they come, a package of food that is supposed to supply 3 days worth of meals for their entire household.
They learn how to read labels, find healthier options, and receive healthy recipes.
Because most people, when they have a chronic condition, they want to be healthy. They want to prevent those complications that can come down the line.
Metro's research from its patient screening found one social determinant that was overwhelming and perhaps surprising: social isolation. And it wasn't just because of the pandemic. So now they have a program where staff members call, check in, and chat with those who reported this issue affects them, so they know somebody cares.